pressure. So the American guys call it a high ankle sprain. Okay, we just call it syndesmosis. So remember I was saying it's all about knowing your anatomy. So I'm going to put you on the spot here. I want one person to draw ATFL. So mark ATFL. Pushing doesn't mind me. Good. And I don't mind it. You make a mistake here, that's okay, but you know, third year students shouldn't be making a mistake, no pressure.
No pressure.
No pressure. Okay, alright. No, I'll let you choose someone else then. I'll start it. There you go. CFL.
It's not that long.
Okay, you point to someone else. ETFL.
We talked about this.
Was it nice to put on the diagram this morning that you'd seen it and yeah. Okay, next person. We're going to send this most now. AI TFL. Anterior inferior tibiofibular fluid. Good. Yeah? Perfect. Good. The pen didn't come up, but I'll give it to you. So, what's that tendon there?
T-band.
T-band, exactly. So, ATFL, so you might have to get that out of the way. And you're looking at the mortise in there, trying to get, so ATFL, AITFL that's in there. Okay, goes across that way. Alright, so. Which one is your mark? That's the mark? That mark?
Yeah.
Yeah. Okay. A little bit just down further. That's all. CFL, yeah. And yeah, PTFL. Good. So just a little bit down further at TFL. Now, so when you find the way I quick eyeball it. So if I had a person come in and I want to assess syndesmosis, can I borrow that one? Yeah. So I would just measure. You can do a tape measure, but I just eyeball it. See the distance between your two malleoli from the medial lateral, and just eyeball that. If a person has syndesmosis, I guarantee that's widened. The mortise is widened. This ligament is after being stretched, so it's not like that. Now it's been stretched that way. We tend to look at what is the degree of damage done. Tends to be how high that AITFL. So I'd come in here, get tib anterior out of the way, and palpate. Now there's the ligament there. So if I go there, you're probably looking at a grade 1. Okay, if I go a little bit higher, and it's painful there, that's probably grade 2. And if I go higher, you're looking at grade 3. Okay? Obviously because you're going in between the interosseous membrane, between the tib and the fibula. Okay, so we get in, and just out of the way. So you palpate, and see how high that ligament goes up, and what tenderness in that space it is. If it's a grade 1, what's the difference between a grade 1 AITFL and a grade 1 ATFL? What's the length of recovery between the two, would you say? Anyone know?
4 weeks.
I'd probably say, close enough, it's double. Double, so whatever a grade 1 is here, you're looking at 7 to 10 days type job. You double it for this one. If it's a grade 2, you're looking at 2 to 4 weeks. You double it for this. So you can see how sometimes you've often heard the statement, you might as well have done a fracture for these ligaments because it takes sometimes that long. Fracture will heal in how many weeks? 6 weeks. If you've done a grade 3 syndesmosis, you could be up to nearly 10 weeks because the whole thing is spread, and then you have trying to get that bone talus to come down and hit the fibula, and the talus hitting the tibia. That's the problem. There's probably an osteochondric defect going on in there. So the test, what are the tests that we'd also use, as I showed you this morning, in terms of assessing?
External rotation.
External rotation is the key. So if I get you down just a little bit over the table so you don't fraction, there you go. So Hopkins developed this test called the squeeze test. So if I press up here, tibia fibula together, it's supposed to widen the Mortise down here. So get the leg across, squeeze, and see does it elicit pain down here. Probably the reliability of it is questionable in terms of testing. So it's probably not a big advocator test. We tend to use it, but you know we wouldn't be, if it wasn't positive or it wasn't negative, I still wouldn't trust it per se. I tend to use dorsiflexion and then external rotation test more so. So I want to make sure that I'm not just external rotating, because what's happening here? The hip. So I want to make sure dorsiflexion and then get into that and just make sure I'm getting external rotation of the ankle. And we'll see, are we spreading that Mortise? Are we having really effect on AI TFL? Right.
If you were to do that movement, would you even need to do a squeeze test?
That's it, yeah. Squeeze says, you know, you might just say, right, interosseous membrane, any problem there, and some people say pain, some people won't. So it's not that reliable, it's not consistently reliable. Or
grade 1, they might just show better with external rotation.
Exactly, that's it. Oh, yeah, external rotation. And as I said to you, always ask the patient to demonstrate exactly how it happened. So, you know, most of them say, I went over my ankle. But if some players are very good, they'll actually say, I went there, and then, boom, my whole body weight got rotated. So there was an external rotation occurred. So don't presume players will tell you go over my ankle. Ask them, and a lot of them will go, yeah, I went over my ankle and I done this as well though. So they don't associate the external rotation as being as foreign. They just think I went over my ankle. So get them to show you and to see was there an external rotation component, because that will tell you then where to start looking in terms of syndesmosis. Plus it'll give you an indication if there is a syndesmosis. There also probably could be lateral ligament damage. That's going to tell you, if the manager is looking for him, oh, it's a grade 1, even the managers tend to look at, oh, so we'll be back in within, 2 weeks. But it's a grade 1 syndesmosis. It could be 2 to 4 weeks. So you have to give yourself that leeway then to get that player to be able to tolerate that load and come back. The treatment and the rehab is the exact same. The rehab essentially is the exact same. But you really have to emphasize to that player, you have the syndesmosis. If you have another syndesmosis, and then maybe another one, at some stage, your ligament could be gone. So what's going to happen then? If that whole Mortise is spread to the point that that ligament is gone now, is totally not in contact, because that's the way they'll stretch. They stretch that way, then stretch, and now it's gone. What would you think will have to happen?
Surgery.
Yeah, fuse them together. Is that player's career finished? So they need to pin and keep that ankle together. So hence why you need to really get the athlete to buy into your rehab, to make sure he's rehabbing that ankle to the best of his ability, so when he does come back, the risk of syndesmosis happening again is totally down reduced, and he needs to stay doing these exercises between that while you're probably strapping. So this is the strapping I would